Good afternoon. My name is Terika Thomas Mills, and today I'll be performing my oxygen administration video. And for this video, I have my nasal cannula, I have my non-rebreather mask, I have my gauze, and I have my hand sanitizer that I'm going to be using for hand hygiene and my patient. So I'm going to enter the patient's room. I'm going to close the door behind me for privacy. I'm going to introduce myself to my patient. I'm going to have the patient identify himself, and then I'm going to explain the procedure to the patient. Knock, knock, knock. I'm going to close the door behind me for privacy. Good morning, Mr. Mills. My name is Terika. Today I'm going to be your nurse, and I'm going to administer some oxygen. Is that okay with you? Okay, so I'm going to perform hand hygiene. Mr. Mills, can you confirm your name and date of birth? Can I see your wristband? Okay, so Mr. Mills has identified himself using two-person identifier, the name and date of birth. Okay, so Mr. Mills, we have noticed that your oxygen level is lower than it needs to be. So what we're going to do, the doctor has ordered that we administer oxygen using a nasal cannula, okay? So I'm going to remove the nasal cannula from the packet, okay? So Mr. Mills, how this works, I'm gonna attach the nasal cannula tubing to a flow meter that is connected to a verified source of oxygen. It's normally in the wall, it's normally green, and it says oxygen, okay? So I'm gonna plug this in. So after I plug it in, I have to adjust the flow of oxygen as prescribed by the physician, which is normally between 1 and 4 liters per minute, okay? And what I'm gonna do, I'm gonna insert these two sprung inside the nostril, and this is what is gonna, the flow of oxygen is gonna go through, okay? So I'm gonna put one in each nostril, and then I'm gonna put the tubing behind each ear. Okay, and then I'm gonna adjust under here to make sure it fits properly. It's not too loose and it's not too tight, okay? Is it comfortable? Okay, so Mr. Mills, there are times when you might experience skin irritation from the tubing. So what I'm gonna do, I'm gonna apply the gauze so as to cushion the skin and protect the skin from being irritated, okay? So I'm gonna apply the gauze behind each ear where the tubing is touching. Okay, so I have applied the gauze for protection to prevent skin breakdown. Alright, so gonna leave you for a few minutes to see if your oxygen level will increase. I'm gonna go document, and then I'll come back and check on you, okay? Okay, knock, knock, knock. I'm gonna perform hand hygiene. How are you feeling, Mr. Mills? Alright, so I noticed that your oxygen level is still low. It's not where it needs to be. So the doctor has ordered that we use the non-rebreather mask. And what this does, this provides a higher rate of oxygen. So this should do a better job than the nasal cannula did, okay? So I'm gonna remove your nasal cannula. Okay, and then I'm gonna unplug the tubing. Okay, and then I'm gonna discard it, okay? So now with this non-rebreather mask, I'm gonna attach the tubing to the mask. I'm gonna attach the tubing to the mask. And again, I have to attach the mask. I'm gonna attach the tubing of the mask to a flow meter that is connected to a verified source. Again, it's gonna be in the wall, it's gonna be green, and it's gonna say oxygen. And after attaching it, I have to adjust it to the rate that the physician has prescribed, which is normally between 10 and 15 liters per minute, okay? So I have adjusted the flow, and if you notice, there's oxygen flowing in the bag is inflated. So I'm gonna apply the mask, okay? So I'm gonna put this over the nose. I'm gonna squeeze this little metal part here to make sure it's adjusted properly. And then I'm gonna adjust the mask under your chin. I'm gonna pull this behind your head, the cord, to ensure that it doesn't slide off. I'm gonna adjust it to make sure that it's properly fitting. Okay, and it's nice and firm. Okay, so we're gonna leave the bag here so the oxygen could flow, okay? So like we did for the nasal cannula, we could also experience skin breakdown or skin irritation from the mask or from the attached cord. So what we could do, we could apply the gauze right under this metal portion over the nose to prevent the skin. And this we could put it along the cheekbone or over the ear for cushion to prevent skin breakdown. Okay? Are you comfortable? Is it okay? Alright, do you understand what I just explained to you, Mr. Mills, and how the non-rebreather mask works? Okay? Alright, so I'm gonna leave it on for a few minutes, and then I'm gonna see if your oxygen rate is gonna increase, and then I'm gonna check back maybe like every 2 hours to ensure that there's no skin breakdown or skin irritation, okay? Okay, Mr. Mills, I'm back. I'm gonna perform hand hygiene. How are you feeling? You seem to be breathing a little better. You're feeling okay? Okay, so now that your oxygen rate has increased, it's exactly where we need to be. The doctor has ordered that we remove your non-rebreather mask, okay? So I'm going to remove the gauze. Okay. I'm going to remove it. Okay. And then I'm gonna unplug it. I'm gonna unplug it from the source in the wall, and then I'm gonna discard. I'm also gonna discard all this in the trash. Okay. All right. How are you feeling, Mr. Mills? You look comfortable. Are you okay? Do you need anything before I go? Okay. So the patient has verbalized that he's comfortable, and so I'm gonna leave the room. I'm gonna go document, but before I go, I'm gonna perform hand hygiene, and I'm gonna close the door behind me for privacy, and I'm gonna go document.